The report essentially says that if you are white in Washington state, well, you just tuned out when you learned that Black lives might be at risk from the pandemic. That you're racist, essentially. That you only cared about your own white lives in your own white universe, and you just tuned out when you heard that BIPOC people needed help. This segment is brought to you by Eastside Weight Loss Clinic. I'm down 37 pounds on the program, and I lost most of that weight in just 2 months. There's no prepackaged meals, no counting calories, no drugs or injections. Schedule your free 15-minute consultation today at eastsideweightlossclinic.com. We're all racist, and if we're white, we didn't care about Black people or people of color dying during the pandemic. That is according to a report called Voices from the Front Lines, a Chorus of COVID, Community Collaborative Thought Partner Project. It says this project captures equity insights from Washington community-based pandemic first responders. I want to read the fine print for you before we get into this because it's going to be relevant to the state of Washington trying to distance itself from this utter nonsense, divisive baloney. It says funding for this document was made possible in part by the Washington State Department of Health through a grant from the Centers for Disease Control and Prevention. The views expressed in this publication and its contributors do not necessarily reflect the official policies of the Washington State Department of Health or the Department of Health and Human Services, nor does the mention of trade names, commercial practices, or organizations imply endorsements by the U.S. government. Okay, so your tax money went to pay for this, but the government's saying, but don't blame us if you don't like something in the report. Got it. We'll follow up on that in a moment. But there was one line in particular. So there's a few things. This frames it through basically they spoke to people who are on the front lines of the COVID pandemic who are non-white to try to get their insights into the response, into the impact on BIPOC communities, and onto any disproportionate outcomes, which frankly I'm fine with. If we want to look at any sort of health-related issue through the lens of is it impacting certain communities more than others, why? Can we change that moving forward? How can we get to the bottom of why that happened? That's fine. I mean, that's been done throughout history, whether you're looking, for instance, at the AIDS epidemic and communities that had a disproportionate impact on, or other diseases or viruses. Like, that's fine. The more we can learn about how a disease or virus impacts groups of people, the better we can respond to it in the future. So I don't have an issue with this report per se. But the report itself is just a bunch of woke words cobbled together into a few pages, throwing accusations at white people without any real impactful takeaways. But let me get to the most concerning line of this whole thing. So there's some policy change recommendations. And one of them is titled, Remember Equitable Decision Making. It says, remember that equitable decision-making is why we improved the rates of vaccination in communities of color. Don't forget, sometimes white people disengaged on safety when they learned people of color needed help. Don't forget, sometimes white people disengaged on safety when they learned people of color needed help. What do you have to prove that? What do you have to prove that white people in one of the most progressive states and places on the planet disengaged on safety when they learned people of color needed help? How absolutely divisive, arbitrary is that? How on God's green earth would you know whether white people disengaged on safety when they learned people of color needed help? That's a nice way of saying that white people are racist and they didn't care about their actions that they took because it would have impacted people of color. And they didn't care if people of color died during the pandemic because they disengaged. Oh, it's people of color who are at risk? Well, whitey over here, well, I don't care then. I'm not going to take any safety measures. Isn't that an insane statement for a taxpayer-funded report? An insane statement without anything to back it up. It's like a throwaway line. Sometimes white people disengaged on safety when they learned people of color needed help. And what I find fascinating is that the very same report says we need to make sure that we're discouraging division. So the very same report, just a couple pages later, it says, don't foster divisions in our community. It collectively costs us human lives. Sometimes white people disengage on safety when they learned people of color needed help. And then the very same report, don't foster divisions in our community. It collectively costs us human lives. So should we be divisive on the basis of race, or should we not be divisive on the basis of race? Because you're being very divisive on the basis of race and then turning around and saying, don't be divisive. It will literally cost us human lives. I would also point out that progressives in this state were incredibly divisive during the pandemic. Chief among them, Governor Jay Inslee, who stood up on multiple occasions at press conferences and basically blamed Trump supporters for killing people.
You are a bioreactor facility generating virus and spreading it around, including to kids who can't get vaccinated. I want to reiterate that. If you're a 50-year-old man who, voted for Donald Trump and didn't think COVID was a problem and you don't get vaccinated right now, you arrest every kid in your city.
Yeah, that's Governor Jay Inslee in the middle of the pandemic. Oh, if you're a Trump supporter and you're not vaccinated, you're killing kids in your communities. You're a walking bioreactor facility. Gee, that really sounds like it fosters division in our communities, doesn't it? And according to this report, fostering division in our community would collectively cost human lives. Yet, white people disengaged and didn't take safety precautions because they didn't care if black people died. Focusing in on that line, because that to me in this report is the most egregious line. And it's very divisive. And there was nothing else accompanying it in the report that would provide any sort of example, like one concrete example of a white person or a white community disengaging during COVID on safety protocols and procedures because they learned people of color needed help. Like, that's quite the divisive statement to just throw out there in a taxpayer-funded study and just see if it sticks without anything to back it up. So we reached out this morning to the Department of Health because the Department of Health sent this out across their social media pages. And we asked them just that. We quoted from the report and we said, what demonstrable, example, what data would back that up? That white people disengaged on safety when they learned people of color needed help. So we just got it. So I'm just going to read you what the Department of Health told us. And that fine print that I read for you at the beginning is going to become very relevant here. They said, thank you for reaching out. The Chorus of COVID Insight report was developed by a diverse group of nearly 20 community partners who were on the front lines serving populations disproportionately impacted by COVID-19. These partners collaboratively authored the report to capture equity lessons learned during the pandemic. The statement in question reflects the personal experiences and observations of some community partners during their pandemic response efforts. As the Department of Health served primarily as the convener and facilitator for this community-led project rather than an author, we don't have specific data or examples to provide regarding this particular statement. The report aims to present a range of perspectives from communities that face significant challenges during the pandemic. Its purpose is to foster dialogue and inform future public health efforts to better serve all Washington residents. We appreciate the opportunity to provide context on this report. Well, you provided approximately zero context on the report. All you did is say, we just convened it and facilitated this community-led project, so we actually can't provide you any specific data or examples regarding that statement. So they funded the statement, they pushed the statement out as the Department of Health, they facilitated it, they convened it, but they're not responsible at all for the content of it. And they can't provide us any actual factual data or examples to back up the absurd claim that sometimes white people disengaged on safety when they learned people of color needed help. And we're just supposed to be okay with that because they're saying, well, these are community partners and community voices that were on the front lines and they're sharing their personal experiences and observations from the pandemic. So we're going to pay for it, right, with your money. We're going to pay for it. We're going to convene it. We're going to facilitate it. But we're not going to require it at all to be factually accurate. We're going to let them race bait and divide, while also simultaneously saying, the next time there's a pandemic, we can't use divisive language because when we divide communities, more people will die.